when you're trying to deal with an infection, you activate a lot of enzymes that need a lot of B2, so you can become deficient. The same thing happens when you have COVID or a lung infection like that. You get this respiratory infection. Respiratory infections seem to be very bad for this. They seem to consume large amounts of B2. And there's quite a lot of kids who've been doing really well, and then they get COVID and they really regress strongly. So that affects it. Using antibiotics affects it because you have to inactivate the antibiotics. So in the process of doing that, you use cytochromes generally that use B2 and iron as part of the inactivating antibiotics. Antifungals are terrible. Some of the kids, they'll get an eye test and they're misread and they say, oh, the child's got fungus, that's why I've got a yeast infection. We've got to treat them with antifungals. They generally go backwards because of that. The other things that can affect it, we've discovered, is that if there's high levels of bromide or fluoride in the water, it can alter the thyroid function or the thyroid's ability to deal with iodide. The others are goitrogens. So many of these things, they don't make a lot of difference if you're replete, because you can deal with them. But if you're not replete, you can't deal with them, so they can have a bigger effect. For instance, cassava or tapioca, which is often in kids' puddings, is derived from cassava, and it has a cyanide group in it. And cyanide can then activate B12. You normally have an enzyme to kick it off. That enzyme is dependent upon vitamin B2. So if you're B2 deficient, then these things can have a much greater effect than if you're not.
One thing, at least in our case, was our middle son never used to get ill. He would never have the common cold or norovirus or any of these things that were, filtrating around the schools. And now, 3 years in to the protocol, we're seeing that he gets a cough, he gets a cold and all these things. So can you tell me a little bit about the immune activation, looking at it from B2 and B12?
Let's be very careful here that we're jumping to something that we have no evidence for.
Okay.
What you do have evidence for is that you change the proteins on the gut wall as you mature your B12. You also change the polysaccharides that are on those proteins. Now, the way that these organisms attach is via specific bindings to proteins or specific bindings to polysaccharides that are on the gut wall of the mucosal system. So you don't know that the reason that he's now getting more infections is because you've actually expressed more things for the bacteria to bind to. So you don't know that. So there are lots of, you could sit down and start going through this whole gamut of possibilities now, none of which you can prove, but would all be reasonable theories. But, you've got an observation that's an observation.
Yeah. Thank you.